that small tiny pimple on your gums that some of you may have been neglecting for a while, that contains potentially pus. That infection can spread not only to the jawbone, to the surrounding tissues, and the bloodstream as well. My name is Dr. Mo, and I'm a dentist. Today, I'll be talking about dental abscesses and simply outlining dental abscess treatments. First of all, let's talk about dental abscess. Dental abscess, generally speaking, we don't like to call it a pimple, but let's just say it's a pocket often filled with pus, bacteria, etc., some other constituents. The dental abscess, it's very important to address it promptly with your dentist or dental healthcare professional, because it may appear as a potentially painful or it could be releasing pus. So it's not always extremely painful. For some people, they're either more pain tolerant or the abscess has a hole where it's draining pus to the outside. It's really different from case to another, from person to another. Okay, so some people just take some sort of pain medication and they ignore it for a while, but that does not really solve the case, which gets us to, first of all, the types of dental abscesses. You can think about things such as periapical abscesses. Periapical abscesses are basically defined by location at the crown of the tooth, okay, the root of the tooth, and periapical abscess often around here, okay, near the tip of the root. With regard to gum abscesses, as its name calls, they occur location-wise in relation to the gums, okay. We also have periodontal abscess, okay, relation to the periodontal tissues. So how dentists diagnose it, it's a mix of clinical exam, investigations, x-rays, um, sometimes feeling it, checking it, all these things help with the diagnosis. Of course, history taking, all these things. That's why seek a healthcare professional to help you diagnose it. With regard to the treatment options, they're going to vary really based on the case, overall assessment, um, also what the patient wants as well, after, of course, a discussion. But generally speaking, drainage of the abscesses to relieve the pressure, relieve the pain, is one of the things. Root canal treatment is an option too. Um, Sometimes there is drainage and, for example, root canal treatment. Something else could be extraction, the removal of the tooth, and other things. Periodontal treatment can be involved, some sort of a cleaning of the infected gum pockets can be taken into consideration as well. The antibiotics can be involved. Really depends on the case, especially in something like acute dental abscess can be potentially taken into consideration. However, you need to understand it's often not the primary form or the main form of treatment. The actual treatment is a procedure that's actually being done, such as drainage, root canal treatment, extraction. So dealing with the actual root cause, not covering the symptoms to just alleviate them a little bit. Possible complications, just like I discussed in the beginning, that infection may spread into the jaw, can facial cellulitis, you can look at it later, sinus infection. Also, in more rare cases, it can spread to the bloodstream, going from a local issue now to a systemic issue. Okay, so of course, prevention tips, simply brushing minimum twice daily. I personally also use a dental floss, having regular checkups with the dentist, make sure everything is okay. And hopefully this was useful to you. Just a brief touch on dental abscesses. Don't forget to like, share this with your friends, subscribe. Dr. Mo Dentist out.